Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. Today we're going to learn about infertility. 1 in 6 people worldwide experience infertility, and yet many do not receive the care they need. Today we're going to find out what treatments are available and learn more about reproductive health. My guests today are Barbara Collura, the president and CEO of Resolve, the National Infertility Association, and Dr. Sasmira Lalwani, the senior director of medical affairs for reproductive medicine with Ferring Pharmaceuticals. Barbara and Dr. Lalwani, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
It's so great to be here. Thank you for having us on and talking about this topic.
So tell me a little bit more about yourselves. Barbara, I understand that you are an expert in infertility. So tell me more about your background.
I have been the president and CEO of Resolve for 17 years. I also had my own infertility journey many years ago, and I know firsthand the ups and downs of this journey, and I've had the opportunity to work with literally thousands of volunteers across the country over those years through our support groups and through our advocacy work. And then I've been able to advocate to state legislators. We're located in the Washington, D.C. area, so I meet with members of Congress. I've actually been to the White House. So I've had the opportunity to really speak for the patient community. I take my role as a patient advocate very seriously, and when I am talking and advocating, it's really on behalf of millions of people who are struggling to build their family.
That's wonderful. So tell me, what is Resolve? What is it all about?
Resolve is a nonprofit patient advocacy organization for people who are struggling to build their family. So we provide information and support about all the different ways you can build your family. We also do public awareness campaigns to educate the public and others. And then we do a lot of public policy work, both in Congress and at the state level, on issues that are important for our community. So we're really kind of the voice of the patient, and we're also here to ensure that patients have all the resources and access that they need.
So Dr. Lalwani, what made you focus your career on reproductive health?
You know, I was, trained in OBGYN, and, at that point, I had just such a wonderful experience with a reproductive endocrinologist and infertility specialist. And, that's how I got into it. And it's just such an exciting field to be in and to really help, people have the families that they want.
So, doctor, define for us, what is infertility?
So infertility is a disease, and it occurs in 1 in 6 people worldwide. So it occurs more commonly than you think it does. And what are the causes of infertility? The causes could be multifactorial. It could be related to female factors such as blocked tubes, dysfunction with ovulation, or it could be due to male factors, or a combination of both male and female factors. And in some cases, you just don't know why, there is infertility. It's unexplained. Typically, we say, one should go ahead and get an evaluation if you've been trying for a year, if the female partner is less than 35 years of age. If she's greater than 35 years of age, we shorten the duration of trying to conceive to 6 months. And the reason we do that is with advancing age, fertility declines. Of course, one also has to take into account, the medical history, reproductive history, and sexual history.
So if you had to really tell us who is most impacted by infertility, what would you say in terms of the population? And either one of you can answer that question.
I'm going to let the doctor answer that one.
I mean, obviously, if somebody who's, advancing female age, right? That's because with women, unfortunately, there's a biological clock, and as one becomes older, the number of eggs starts going down and the quality of eggs starts going down. So it's really important to be aware of that and not wait too long. Right?
Yes.
Don't come at, 45, and because even with the best technology, we're not going to be able to help you with your own eggs. Of course, there are different pathways to parenthood, but again, just have that awareness. Or if you're not, ovulating regularly, or there's been history of infections or chemotherapy.
One of the things about infertility that I think is a big myth is that it's a women's disease. It actually impacts men equally as females. And so you have, you need a sperm, and you need an egg, and you need a uterus, and any one of those could have a problem. So I just want to emphasize, whereas women are seeking care every year through their primary care or their OBGYN, maybe for contraception or for other reasons, men don't always interact with the healthcare system as frequently. And so we oftentimes don't think about the fact that men might be suffering also from infertility. That's why going through all those diagnostic tests to see how the sperm are performing, to see if there's egg function, and then to see if the uterus is healthy to carry a pregnancy. I think we oftentimes forget that this is both men and women.
Right. Yeah, that's a very good point, Barbara, because 1/3 of infertility could be really solely related to a male factor. So that's really an important point that you brought up.
So how early should we look into whether or not we are fertile, infertile or not? At what age?
I think whenever you've been trying, right? And also based on your history. So the age is when you're ready to do it, right? And again, as I said, we need to educate everyone, like with advancing age, fertility does decline, and also, look at what your history is.
And if your history, and let's just say you're a woman and maybe you've had irregular periods, or maybe you've had heavy periods, and you're thinking this is normal. I would say, regardless of what your age, even if you're not even trying, have that conversation with your healthcare provider and be a little advocate for yourself. Sometimes we get dismissed and we're told, look, you're not even trying to get pregnant, you don't need to worry about this. I would actually have those conversations when you feel that, like, maybe I should let my doctor know this is what's going on with my body. That way, you're more informed. And we like to think that having that information is powerful for you as you make your own healthcare decisions. And you've really got to advocate for yourself and bring up what might seem normal and see if there's an underlying condition that might impact your future fertility.
Yeah, it's never early enough, right?
Yeah.
It's never early enough, and at whatever age. So if you feel you have some medical issues that need to be resolved or spoken about, please go and see your physician.
So there's really no one-size-fits-all way of, I would say, looking into how fertile or infertile you really are. There's no standard.
You think, you hear a story, right, of somebody who's gone through infertility and built their family a certain way, and you're like, oh, okay, that's what I'm going to do. And then you find out that they had a completely different diagnosis. And so I like to say, Dr. Jeanine, we hear this term personalized medicine, right? We hear that term over and over and over in the healthcare space. Quite honestly, this is the most personal of personalized medicine, because every person that walks in that door has a different story, a different condition. Maybe it's a same-sex couple. Maybe you're going to be a single parent by choice. Maybe you're that cancer patient who needs to freeze the sperm or the egg. Maybe it's, like we said, male factor. There's any number of reasons why you might be accessing care, and there's so many different paths to parenthood. It's really individualized, and so not only do you need to get that diagnosis, but then you need to think through your own family choices and decide what's going to be best for you. It might be that you build your family through adoption and you completely bypass medical care. You might go through this and say, you know what, we're going to live in a family without having children. It is all your choice in how you approach this.
Very personal decision, yeah.
Right, and I'm just going to tag on again to what Barbara said, so the importance of awareness and education.
Yeah. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about infertility and the treatments available to help struggling people start a family. My guests today are Barbara Collura, the president and CEO of Resolve, the National Infertility Association, and Dr. Sasmira Lalwani, the Senior Director of Medical Affairs for Reproductive Medicine with Ferring Pharmaceuticals. What are some common diagnostic tests that we can expect to go through if we are infertile or suspect that we are infertile?
So, as Barbara said, you need sperm, egg, and you need the uterus, right, to get pregnant. So those are the things that you evaluate. So you look at, the eggs, just looking at, the quantity of eggs present. So we do certain blood tests, make sure the other hormones are normal, like thyroid. Then we do an evaluation of the tubes, right, the fallopian tubes, and make sure that the inside of the uterine cavity has no polyps or fibroids that's impacting an implantation. So do we do a dye test known as a hysterosalpingogram? I know it sounds a little bit of a mouthful, but it's basically a test to see whether the tubes are open, and then do a semen analysis to make sure that the sperm counts and motility are normal.
What is the most common problem that you encounter, doctor? Is it the tubes? Is it the sperm? What are you finding?
So it's kind of a rule of thumb, not rule of thumb, but just to be simplistic, it could be, 1/3 female, 1/3 male, and 1/3 combination of male and female. So for female factors, it could be due to ovulation disorders like polycystic ovarian syndrome, 15 to 20% could have that, or endometriosis, or could be due to structural problems.
And fibroids, right?
Right, and I was just going to get to fibroids, absolutely.
And how prevalent? I'm hearing that, is there an increase in the fibroids as we seeing more and more of this on Long Island in particular, or generally?
I don't think there's an increase. It's just that there's more awareness also, about the presence of fibroids with heavy bleeding, and also our imaging techniques have become so good, so we are picking up also a lot more.
And Dr. Jeanine, if I could just piggyback on that, I think women for many, many years have been told what they're experiencing is normal. Heavy periods, not having periods, all sorts of other conditions, and they've been told, it's normal. I mean, I always say to women and young girls, if you are in so much pain that you have to stay home from school or you have to stay home from your job because of your menstrual cycle, that's not normal. If you have heavy bleeding, that's not normal. If you miss months of a cycle, that's not normal. And so don't take any of that as normal. Get medical care. So I think what we're seeing is more people realizing, hey, wait a minute, this is maybe not normal. I'm going to talk to my doctor about it. Right. Then they find out from their mom, their mom had it.
Had the same thing.
Was diagnosed, never told their doctor. Everybody said it was normal. Yeah, so we're becoming better advocates, which is good news.
So Barbara, Barbara, is this a familiar tendency? And just keep it there. Yeah. We're seeing more. So if my mother had this issue with infertility, there's a strong possibility that as her daughter, I may have a similar.
It depends on what it is, but if we're talking about things like uterine fibroids and polycystic ovary syndrome, endometriosis, these are things that could have a genetic linkage, or even sisters. So definitely, and certainly some of those conditions we see a more prevalence in the African American community.
Yes, I was going to say that.
And so we really need a lot more awareness and education. and advocacy, certainly.
Let's delve a little bit further into the treatment options. I think a lot of people are interested. How and what is available? I know some things are very expensive when it comes down to infertility treatments. Talk a little bit about what's available out there.
So from the treatments, it could go from low-tech to high-tech. So it depends on what the underlying cause of the infertility is. So say someone with PCOS, she's not getting pregnant because she's not ovulating, right, regularly. So you give medications to go ahead and help her ovulate it. Then there could be there are other low-tech treatments like for unexplained infertility where you give oral medications just to increase the number of eggs that get released, and then you couple it with an intrauterine insemination. So just by increasing the number of eggs that release and increasing the amount of sperm you put back by doing an intrauterine insemination, you're just increasing the odds of pregnancy. And then the most high-tech treatment we have, which is the advanced medical treatment, IVF, which is really a very effective treatment, and it's got the high success rates.
So IVF stands for what?
In vitro fertilization.
In vitro fertilization. So what happens with in vitro fertilization? What are we doing?
In vitro fertilization is an advanced medical treatment that's been around for over 40 years. In fact, 2.5% of all births in the United States are with in vitro fertilization. Now, with in vitro fertilization, the eggs are fertilized by the sperm outside a woman's body in a lab, and then an embryo or the embryos are transferred back inside the uterine cavity to achieve a pregnancy.
And what is the success rate for IVF?
So the success rates depends on the age. The younger the patient is, the higher the success rate. So like at the age of 35, the success rate is 50 to 55%. And as you become older, say you're at the age of 41, 42, it goes down. It's like about 10%. So it all depends on the age, which is due to the quality of the eggs.
So can I freeze my eggs?
Oh, absolutely. And it's better to freeze at a younger age, right? Because for that same reason. And that's really important for people to know. Don't wait till you're much older, because the eggs that you're freezing are, the quality is starting to go down.
And I also can freeze sperm as well. Is that correct?
Yes, absolutely. And certainly if you're somebody who's going to be going through like a cancer diagnosis, you want to be sure you have the opportunity to be able to freeze sperm or freeze egg. That might be sickle cell, that might be some kind of medication that's going to cause your future for fertility. It's not just cancer. So talk to your doctor if you're of reproductive age and you're going to be put through some sort of medical intervention. Say, hey, could this impact my future fertility? And then what are my options to preserve that?
So this infertility, the whole process is very emotionally draining, I'm sure, for the patient, as well as the couple, as well as the family, the whole family dynamic. Do you provide any kind of emotional support for patients and or their families that are going through this process?
Yeah, well, you hit the nail on the head. This is a very involved journey, and it has lots of ups and downs along the way, emotionally draining, as we say. And so we encourage people to, first of all, understand the seriousness of this journey and to seek out help, whether that's through friends and family, but really to think about your support system. Make sure you have a support system. If your friends and family are not necessarily where you're going to get that kind of support, go to an organization like Resolve. We have support groups. We have online communities. There's also mental health professionals. I myself went through infertility. I ended up seeing a mental health provider for about a year for my journey. An infertility diagnosis in my case was devastating, and it caused a lot of depression and anxiety, and I really wasn't even able to make a decision about what to do next, and I really needed that professional help. So don't be ashamed. Find your community, find support. Don't go it alone. If there's any piece of advice I have, is don't go it alone. And you are not alone either. and know that there's a community here to help you.
Yeah, and I'm just going to add on to, what Barb said. It's having practiced for, over 20 years, I've seen multiple patients go through this journey, and it's challenging. Mm-hmm. I was a patient myself, who went through this. So it's, again, the importance of support, also getting right resources, Resolve.org has resources. Ferring has a website for Fertility Out Loud that has, good, trusted, valid resources to help patients through their fertility journey, and also has a text-based platform that, where intended parents or, prospective parents, aspiring parents can be teamed up with a fertility coach. So just be loud, share your stories, and we really need to destigmatize infertility.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about infertility and the treatments available to bring and to help struggling people to start a family. My guest today is Barbara Collura, the president and CEO of Resolve, the National Infertility Association, and Dr. Sasmira Lalwani, the Senior Director of Medical Affairs for Reproductive Medicine with Ferring Pharmaceuticals. You both talked about a little bit about the financial piece with infertility. What are some of the options? I know when you spoke about IVF, that is a very expensive treatment option. Does insurance cover this? And if not, how much are we even thinking? Just give me a range out of pocket.
Yeah. Well, this is the question I get all the time because we, as IVF patients, we seem to know every penny that we spent on our IVF cycle because we are paying out of pocket, as you said. I oftentimes say to people, do you know anybody who's had maybe a knee replacement or maybe somebody who had an emergency room visit? What if one of your friends had a cesarean section? Do they know how much any of that cost? And everyone says no, and that's because their insurance covered it and they didn't have to pay out of pocket. So one of the things that we do at Resolve is we advocate for health insurance because this is number one reason why people are not getting the care that they need and deserve is because their health insurance doesn't include this and doesn't cover it. So we advocate both in Congress, in Washington, D.C., we advocate at the state level, but people advocate with their employers. Mm-hmm. What we're finding is companies are adding this benefit because guess what? It recruits talent, it retains their employees, and their employees tell them over and over, this is a benefit that they want. Mm-hmm. So let's give it to them. Comprehensive coverage. We're seeing more and more and more employers adding this as a benefit. Now, if you are having to pay out of pocket, you're going to potentially spend anywhere from $15,000 to maybe $25,000 on one IVF cycle. And so you can see that out-of-pocket cost. It really starts impacting who can get care and how many IVF cycles potentially you could do. So we've got to get this covered by comprehensive health insurance.
So you talked about Resolve, and it sounds like Resolve is an organization that has so many different arms. Can you explain? I hear so many wonderful things that Resolve does. Give me a little bit more and tell me where can we find information about Resolve?
Well, Resolve is such a wonderful organization. It helped my husband and I go through our own family building journey, and it really is there to meet you where you're at. So maybe you just need some medical information and you need to ensure that what you're thinking about and what your doctor is talking about is something that's right for you. So you go to resolve.org and you look up that medical information. Maybe you're somebody who, I really need support. I need to find other people who are going through this. You go to resolve.org and you're going to find online support communities, you're going to find virtual support communities. Maybe you're going to find a support community or a support group right in your community, in person. And then if you're like me and you get a little bit fired up that your health insurance didn't cover this and you want to do something about that, you kind of are pissed off about that fact, you can advocate. We have thousands of people who raise their voice and advocate alongside of us in state capitals. We have a big advocacy day actually coming up in May, virtually with members of Congress. And so you have an opportunity to get a little bit of control back in this journey that quite honestly takes a lot of control away. And maybe at the end of the day, you're not helping your situation, but maybe you're helping the next person. And I have to tell you, what we hear a lot from our advocates, they tell us, look, if my kids have the same situation that I had, shame on me. It's got to get better for my kids so that this journey is easier.
I just want to say, like, as a provider also, like, I just want to applaud all the work that Resolve has done over the years.
Well, thank you.
And I've personally seen patients benefit from Resolve.
So when individuals are experiencing infertility, Barbara and also Doctor, how long do you think support is needed after infertility? I know that this is something that it can be a very, I would say, grueling process when you are attempting to get pregnant, have a child, and over the time, you're not successful. How long does that emotional support is needed for individuals, do you think?
You know, from my perspective, as long as you need it until you feel like you're in a good place, maybe you're going to have to go for a second child. Maybe you're experiencing something called secondary infertility, where you were able to have a child without any kind of medical assistance, and you thought you were kind of out of the woods, and then you try for a second child and it's just not working. So these are all opportunities for you to get support. I don't know that I would say there's necessarily a one-size-fits-all when it comes to how long. I know for myself, it was really when I was able to get to a point where I could make a decision and I felt some control back into my own family building journey. Did I feel like I was okay on my own? But I really needed to check in with myself and my spouse and make sure that I was in a good place to make those decisions.
That's very well said. I would say the same thing. It's a very individual need as to how long you would need that support.
Well, thank you so much. You both have been very informative for individuals who are experiencing infertility. And we want to thank you for being here, Barbara Collura, the president and CEO of Resolve, the National Infertility Association, and Dr. Sasmira Lalwani, the senior director of medical affairs for reproductive medicine with Ferring Pharmaceuticals. We thank you both for giving us this very important information, and we hope you both continue to stay healthy and do the grand work that you're doing, so needed in our community today. This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.